I'm very much looking forward to making the trip over to beautiful Queenstown to speak at the New Zealand Chiropractic Association's annual general meeting and conference. Let me take a few minutes now to tell you just what I'll be talking about. Clinically, I've been in full-time practice now for over 17 years in Sydney, and I've been board certified in chiropractic neurology since 2006. My other great passion though is education and the power that it has to elevate our professional standing and authority. Now this obviously starts at the undergraduate level, and having lectured in neurology at Macquarie University for the past 11 years, I've been fortunate enough to contribute to the journey of thousands of aspiring chiropractors. But the real learning starts with clinical experience, once you're actually in practice. You need to feel that you are getting better at what you do with every day that passes. Each of us must strive to execute with greater precision clinically, but also to be ever more effective at demonstrating that expertise with cut-through interprofessional communication. And it's this ability to demonstrate the value of our role in the healthcare team that is so vital in today's collaborative environment. But to get the right skills to succeed in practice, you need the right learning resources and the right tools. And this is why Matthew Long and myself created Chiropractic Development International, or CDI, back in 2002. As CDI's Chief Executive for these past 13 years, I've overseen its growth from an early provider of workshops in interprofessional communication to one of the leading providers of advanced online continuing education for chiropractors around the world. As one example, our online programs are now being used by chiropractors in the United States for board certification in order to prepare them to take leadership positions in hospitals and multidisciplinary clinics. So now more than ever, as a chiropractor, you need to be considering how you develop your skills for the future. And this brings me to the main topics of my presentation at the AGM conference in May. The first major theme of my presentations over the weekend will be this: what do we need to know in order to stay at the leading edge of neuromusculoskeletal healthcare? And let me emphasise the word know as opposed to the word do. You see, there is a huge focus on what we do. Chiropractors manipulate or adjust the human frame. But this leads to chiropractic being seen as a treatment. And a treatment can either be effective or not effective, and it can be called into question. We could all be seen as delivering the same treatment, and patients could say, "Oh, I've tried that treatment and it didn't work." But chiropractic is not a treatment. Chiropractic is a profession. And a profession is a group of individuals that possess highly specialised knowledge, skills and expertise. And when a group of professionals are seen to know more than anyone else in a certain field of endeavour, then a natural level of respect develops. To say it really simply, when what we know is valued, what we do is trusted. With knowledge, we triage, assess and differentially diagnose. With our skills, we then apply an appropriate intervention, which is guided by a robust framework of clinical reasoning. So let us not confuse a treatment with a profession. So I'm going to talk about what we as a profession need to know throughout this weekend. How does spinal dysfunction disturb balance and global postural stability? How does pain change our patient's brain and influence their movement behaviour, confidence, and overall sense of well-being? Now, the other major theme across the weekend will be act locally but think globally. Our profession places a strong emphasis on looking at the whole person rather than just isolated complaints. But it can be difficult to clearly conceptualise just what happens beyond a local mechanical change, and then to simply explain that. And so a major part of what we do is to deliver highly skilled passive movements to the joints of the human frame. We do so using a continuum of speeds, amplitudes, and subtle differences in angular acceleration, with the most potent arguably being the small amplitude high velocity thrust. Now, what does it really mean then to act locally but think globally? I'm sure this is a concept that you're already familiar with in some way, but how does it actually play out in practice using everyday patient examples? Well, to answer that, I'm going to pose a series of questions to you throughout the weekend, such as the following. How could a local mechanical force have a global influence? How could a specific and refined joint movement influence the brain and central nervous systems of our patients? How could this improve their quality of life and elevate their sense of well-being? How do you use the latest evidence to communicate that effectively to other clinicians and patients? What does the concept of sensory motor control mean to you? We'll talk about how vitally important this concept is off the back of a swell of evidence coming through about how the neck influences overall balance, postural control, and motion sensitivity. What happens to a patient when their pain becomes chronic? What is chronic pain really? And how does a local injury become a global neurological affliction? We now know more than ever before about the types of changes that have taken place in the circuitry of their spinal cord and brain. But how do you most effectively manage these patients? And how do you effectively communicate your important role as their clinician? CDI has presented face-to-face training programs in New Zealand many times before, as well as around Australia and Southeast Asia. But our programs are always evolving, with new information and new insights from the evidence base. So it doesn't matter whether you've attended one of our programs before, there will be a whole lot for you to take away. Our job is to ride the leading edge of the healthcare and evidence wave. And being scientifically agile means constantly adopting the very latest concepts, terminology, and language that comes through the evidence base, but continuing to infuse that with our unique approach to the whole patient. So this will be different to anything you've seen previously. There is, of course, the well-known Use It Monday Index. And the answer to this comes down to how I'm going to present the information. Take a moment now to think about how you store knowledge. You create your day through a series of patient encounters. You have to think on your feet and solve problems as they arise. So that's exactly how I'm going to structure my presentations over the weekend. We'll walk through a case, pose a clinical question, and insert new information at the very point in which you need it to answer that question. I'm hoping that Monday will be different for you when you have a greater clarity about how a local mechanical force could have a global neurological impact on things such as balance, sensory motor control, chronic pain, and an overall sense of well-being in your patient. Not only that, but we'll look at simple ways in which you can refine your patient examination and treatment approach based upon these types of problems. I'm certainly looking forward to engaging with all of you in the New Zealand chiropractic profession again, especially against the spectacular backdrop of Queenstown. This is Dr. Anthony Nicholson, and I hope to see you there.